It's time now to reevaluate and adapt to what we are seeing now.
Provincial leaders in the response to BC's unregulated drug deaths are taking stock of what isn't working with the province's limited safe supply program. Provincial Health Officer Dr. Bonnie Henry joined the Chief Coroner Lisa Lapointe for an update on BC's response to countless toxic drug deaths Monday afternoon. She says one of the things that isn't working is hydromorphone, which is prescribed to manage opioid addictions.
We are hearing from clinicians that this prescribing, particularly of hydromorphone, is not meeting many people's needs. And they are hearing concerning stories, which we've heard as well.
She says some of those stories include people selling the medication for drugs they want. Currently, to access these safe supply drugs, a physician or nurse practitioner has to provide a prescription, a system Dr. Henry says is hard to scale up across BC. She says the province is exploring different models for people to access safer supply, including non-medical options.
Like, they talk about expansion, but it doesn't seem like they're stepping in the right direction still. Like, we're still dealing with a lot of death.
Peer support worker Cully Sudgmore says while there are some safer supply options for opioid users, it's not the same for users of other drugs that are getting increasingly toxic.
Well, stimulant use has increased. We see that on the ground, but we also see that from literature and stuff and what they're calling the new meth epidemic, but it's not really an epidemic. It's been happening for years. And it's what needs to be done is, like, we need access to better safe supply options that are more than just dextrogen and Ritalin.
At this point, Dr. Henry says there's no definitive safer supply model BC may move to, but suggests future options will better reach rural areas and communities with specific needs.
It's not just drugs being available to people whatever they want, whenever they want, but what we need to have is controls that meet people's needs with different medications being available.
In Vancouver, Kier Junos, City News.